Do you feel all doctors should be fit people?
Oh, of course. Indeed. It should start from their own health.
You can just buy that supplement. You don't have to use it as an excuse to have another bottle of wine. People who are like IV drug abusers with heart conditions,
That is directly causing your increase in heart attacks.
which is the best way of consuming caffeine for your heart. ये आज तक का आपका सबसे इम्पोर्टेंट क्लिक होगा जो आपने किसी यूट्यूब वीडियो पे करा होगा. ठीक है, प्लीज वॉच द फुल वीडियो बिकॉज टुडे वी गोना बी डिस्कसिंग अबाउट हार्ट हेल्थ. ठीक है, एक बहुत ही क्रूशल ऑर्गन हार्ट जिसके बारे में बहुत लोगों को ज़्यादा नॉलेज नहीं है. सबको हार्ट अटैक्स के बारे में पता है कि इंडिया में कितना प्रेवलेंट है ये इशू. एंड टुडे सुशी टॉक्स विद डॉक्टर देवेश भरगुडे हु इज अ कार्डियोलॉजिस्ट. हाउ आर यू सर?
I am so happy to be here. Yeah, I'm doing great.
Dr. Devesh, also known as the FitDoctor, is like I'm a fan of his content on
Hardly.
Instagram. Yeah, and like he has been motivating a lot of people to get on the fitter side, and also motivating a lot of doctors also to actually become fit. So, Dr. Devesh, how did you get into fitness and everything?
Well, for me, it was just gaining some amount of weight to start with. And I started doing it 10 years back. So I was just a skinny, lanky kid,
Okay.
who's just out of his 11, 12 standard and wants to just put on some weight to look healthy. So that was it. I was always into sports and athletics during school times. But gymming is something that I had never encountered. And neither did I felt the need to go to.
Yeah.
But yeah, so I went to gym and I saw seeing results after like 3 to 4 months of continuous persuasion. I started seeing results, and I don't know, it sort of just became
A lifestyle.
a lifestyle. Or initially to start with, it became like something like an addiction, and then eventually you just realize that it's just a lifestyle
So
that is a perpetual thing.
after completing your residency, such a hectic residency in general medicine and getting into cardiology, how did you manage fitness with this particular lifestyle? क्योंकि इतनी emergencies होगी कार्डियो में तो.
हाँ, वो तो है. I would say it's a priority and a choice. It's if you want to do it, तो आप कर ही लो. It's nothing that the residency or you don't have time, you've not slept, you've not eaten. I don't think those are the drawbacks. मैंने 36 hours का emergency करके भी workout किया है. Although I would not tell people to do that, but I guess at the end of the day, it's a priority and a choice.
Do you feel all doctors should be fit people?
Oh, of course, indeed. It should start from their own health. Then that'll percolate downstream, right? If you take care of your own health, I just feel you would be able to take better care of your patients as well. And why shouldn't they be fit?
Yeah, because like there is a notion like we see a lot of endocrinologists with big bellies and they are telling patients to get on oral hypoglycemic agents and
शायद इंडिया में डॉक्टर्स का इमेज ही वही हो गया है.
हाँ,
Doctors is someone who is elderly, it's 45, 50 with
belly
a
and
lot of
bald head.
central visceral obesity, bald head, something like that.
So I think this generation is quite different because we are growing up.
Oh, yes,
we are
indeed.
growing up with social media and lot of health awareness. And अब आप देखोगे just like you, FitDoctor, Instagram पे बता दिया है कि this doctor, yeah, if you're coming here, you're gonna see my physique and my work also. Yeah, so this is very good. So let's first talk about fitness related things. Okay, so I have a lot of doubts,
Sure.
and I think you can help a lot of people out here. Creatine monohydrate is one supplement which which is like scrutinized by a lot of people. Do you think like it has like benefits, or do you feel ki it causes like
Yes.
renal issues?
So benefits, or definitely, I use it myself and I can vouch for it. It's self-tested, so creatine does work, especially during the start of the set, or just that extra push I believe it could be creatine, so helps in your muscle hypertrophy, muscle gain, and overall strength and volume. So I'll tell you why the creatine issues and the rumors are being spread the way they are. First of all, yes, it's a compound which is going to retain water in your muscles. It has intracellular mechanism. So once it goes inside, the, due to it being an osmotic agent, it's gonna retain water inside your cells. That does not mean your rest of the body is gonna get dehydrated. So better to just drink adequate water, especially if you're on creatine. And coming to the part that whether it causes renal issues or not, there is absolutely hardly any literature, studies, trials which prove that it causes any sort of renal damage. I would say it's not recommended in those with pre-existing renal damage. So that could get worsened because of creatine, since it's obviously causing a lot of extracellular dehydration, I would say.
Okay, okay,
So overall, your muscles are getting enough hydration. Their volume is increasing, and creatine dosages is something that they have tried and tested. So the dose that initially they say that you have to do loading as
loading
well as the
and
maintenance.
maintenance. Yeah.
Yeah, but right now the literature is again variable. So where they say you can just be on maintenance dosages. The one that I personally have experienced gives me the best benefits is between 5 to 10 milligram per day. And if you, I have taken it almost every day, and it definitely works. So
Yeah, I think that's
as per
also.
my opinion,
Yeah.
yeah, you
Card-
better.
Creatine is cardiologist approved, guys. Okay, so now coming to this big controversy regarding what ICMR said about whey protein. So they told ki whey protein brands, all of these
Right.
whey protein brands who are available in the market, they are harmful for the for people. And do you agree with the statement?
Uh, I wouldn't say perhaps the whey protein as a product overall. I would say the adulteration that occurs in the Indian market, that could be harmful overall. But whey protein, just pure source of whey protein, is not harmful at all. Rather, it's just another dairy product which has been purified, which has been filtrated, and you better consume it if your protein demands are not being met on your daily food intake. So ICMR research is not something that I've gone through in detail. It's just the highlights which I've read. So if I happen to go through in details, I think there are going to be many flaws, and especially the products that are being marketed, the cheap ones usually, and the middle class ones and the lower class ones usually go for these products. They could be harmful per se. So the I'm not denying the whey protein as such, which is harmful. I'm just
But the
denying
adulterants.
that, yeah, the adulterants and the adulterated proteins, which are cheap and which are not that, I say, familiar with me at least. I wouldn't say that to be consumed.
Okay, so I just like you, I also got into fitness like thoda late, but der hai durust hai, and one of the crucial things that
It's never too late.
yeah, it's never too late, and even if you're 40, if you're watching this in your 30s or 40s, and you feel ki
Yeah, indeed. I believe the best time was to start 10 years back, but the next best time is
start
right
today.
now.
Yeah. So
Yeah.
one big change that I did during my fitness transformation was switching from a vegetarian plant-based diet to a non-veg diet, non-vegetarian diet.
So that
So
makes the two of us.
So we like I've and before doing that I was very hesitant because people were saying if you are consuming non-vegetarian food, you will also get a lot of bad cholesterol also inside your body, and it can lead to heart problems. Plus uric acid, which also comes with eating non-vegetarian food, which is like high
Correct.
in protein. So what are your thoughts on this?
No, it's the preparation of the meat and the non-veg sources that would hamper your cholesterol levels, not the consumption of lean and clean non-vegetarian sources overall. So I believe it's when you put a lot of oil, a lot of salt, and those are the things, extra additional things which are making your food tasty, but those are going to hamper your cholesterol levels. Red meat and pork is something that indeed itself has high levels of fat. So I would say appropriate consumption of non-lean red meat that could perhaps cause raise that might raise your cholesterol levels. But overall, मुझे नहीं लगता है कि just having red meat, pork, or the lean sources, the best ones are like your chicken breast, your fish, the eggs.
Turkey.
Yeah, I turkey. I don't think it should hamper your lipid profile to that level. Uric acid, yes, again, it's about the preparation of the food, and uric acid is because your is because of the byproduct of your proteins, which are amino acids, which are getting converted to your ammonia, eventually uric acid, and maybe that's how the trend has started. But no, I
So
consuming consuming non-veg and to worry about uric acid is just another level. Yeah, it's just
so
another level of hangover.
according to you, according to your cardiologist, what are your favorite protein sources?
Oh, so my favorite protein sources you're asking. So the ones that I consume daily is eggs, one of the perhaps the best source of protein, lean protein. So I take chicken, but when I was in Mumbai, fish was rampantly available. So fish is one of the best. I would say fish had given me better results. So chicken is again the best chicken. Uh, then, if you want to talk about vegetarian sources, I consume a lot of cottage cheese. I take some amount of peanut butter. Then, whey protein is again one of the best lean sources of protein. You can consume sprouts, but yeah, that's a lot of
you ha-
preparation
you
and
have to consume a
getting the
lot of
sprouts.
squats. You have to
Yeah, yeah, yeah.
consume a lot of it so as to get adequate amount of 20-30 grams of protein from it. And
Indeed, indeed.
vegetarian sources ke sath there is an issue ki like you don't get the full amino acid profile when you're consuming those kinds of food, except like dairy ones. Dairy mein it's chill.
Correct.
Okay.
Soya is something I take once, or soya and tofu is something that I take once or twice a week.
Okay.
So yeah, that's also one of the best sources of
Soya is also
protein.
very ostracized. Does it
I mean,
really
the phytoestrogen content, yeah.
because of the phytoestrogen content? Does it really
I
cause
mean,
like
who consumes it daily? You're
uh,
not consuming it as a source of protein for your daily consumption. That is when it would hamper your estrogen levels.
उससे ज्यादा
Yeah,
फाइटो
it does have.
तो आई थिंक हमारे फ्रूट्स एंड वेजिटेबल्स पे स्प्रे होता है जितना सोया में होता है वैसे
हो सकता है, हो सकता है.
हमें क्या पता व्हाट एवर वी कंज्यूमिंग.
Even the cosmetic products now, a lot of phytoestrogen.
So if you want to watch a video on cosmetic products, we have already made one podcast with Dr. Eva Batra. Please click link in the description. Okay. Now coming to heart attack. We have heard this term a lot in the news. Children are getting heart attacks in the gyms, and like India is known as the diabetes and the heart attack capital of the world. So what exactly
Indeed.
is a heart attack?
So let's just assume that heart has three major blood supply arteries, which are going to provide nutrition to the muscle of the heart. So heart attack is simply a blockage of either one or all three of those arteries, in which the heart muscle is not getting enough blood supply, so it's gonna crack and eventually it's gonna die. So heart attack is your umbrella term. The more scientific version of it would be your myocardial infarction, which is death of the tissue. And then there are various subsets of it, which all of us use, you and I use in medical terms. But yeah, I think I believe heart attack for layman terminologies would just be a blockage, a blood stoppage in the blood supply of one of the arteries which is supplying to your heart.
So, why are we getting these news reports of young adults getting heart attacks these days?
Smoking, man,
Smoking.
it's so crazy. It's so crazy these days. I see 20 year olds, 23, 24, 26, 27, people younger than me who are, getting massive heart attacks. Just just the risk factor is smoking. They start even the 2, 3 years of smoking, even one time if the binge smoke, that could just cause vasospasm, is coronary vasospasm is what we call it. That's just like your artery getting choked up for some time, and that might just end up, in causing the blood supply to uh, to be inhibited for some time, and that just damages the heart forever.
Do you feel these pre-workout supplements which have a high level of caffeine in it and other things like beta alanine, L-citrulline, these are causing the heart attacks?
Uh, well, the amount of these substances that you would have to take would be so high,
Okay.
and again, yeah, the caffeine would per se needs to be taken in a massive dosages, which yeah, pre-workout supplements do have, and that just like I previously mentioned, it causes coronary vasospasm, and that could lead to heart attacks. But these are not the very common causes that I have encountered in practice, unlike smoking. So although I've not read about it quite a lot, and the literature does not, I have not come across the literature about it. Let's see if how often. Let's see in future if I happen to see cases like that, I might be able to provide better insights about it.
Like let's say one person wants to smoke, okay, and he has a choice between cigarettes and vapes. So according to you, what should he choose?
Nothing, man. Everybody just go suicide.
Yeah, it is
There's
basically.
absolutely there's absolutely no there's absolutely nothing that is that is safer compared to the other. But still, if put a gun to your head and then asked to do either, one should go for vape. But that's not my recommendation at all.
Like
Like I'd never do. I'd never, never ever recommend.
इस जगह पे I think we have a difference of opinion. I feel cigarettes are healthier than vapes. ठीक है, because
You
at least in the cigarettes I know about the carcinogen profile. ठीक है कि like I know like vapes में I don't know what chemicals they are using in the manufacturing process, and with cigarettes, yeah, like you get a lot of chronic problems which are both pulmonary and cardiovascular, but with vapes you get a lot of acute issues also, like we have heard about this popcorn lung and cases of lot of
oh
pleural
yeah,
effusions and pulmonary edemas.
E-Valley.
Yeah,
It's
तो दोनों ही मत
uh,
यूज करो, but
electronic wave associated lung injury. This is the
yeah.
term that was introduced. E-Valley.
Okay, so can you, being a cardiologist, आप रोज लिपिड प्रोफाइल्स तो बहुत चेक करवाते होगे अपने पेशेंट्स के,
Now
so
every other patient. It's a basic investigation.
this is a basic investigation, right? So, can you explain what are the different parameters under a lipid profile? What is good cholesterol? What is bad cholesterol? And how can
Oh,
people?
those terms are absolutely they are banned now.
Okay.
We would never use it, at least in our institutes. So what we usually check are four things: it's total cholesterol, so high density lipoprotein, low density lipoprotein, and your triglycerides. So these are the four parameters that are being checked for every patient. So what previously they used to say is good cholesterol, which is your high density lipoprotein. So simply what it means is it's going to take the fatty acids, the fat from your peripheral organs, everything to the liver. So your liver will cleanse your body of all the fat that you have in your system. So it's like it'll take, it's like a ferry which will take fat from, let's say, your intestine, your kidneys, your heart, lung, everywhere, and will take you to the liver, give you to the liver, so liver will get rid of it. That's your HDL.
Hmm.
LDL is exactly opposite. LDL is something that's coming from your intestines,
Hmm.
and sorry, it's coming from your liver,
Hmm.
and then it's going to the periphery. So that is what they call bad cholesterol.
Okay.
But I would say it's not like bad. You do need some of it for survival. But I've seen in practice there's absolutely no lower limit to your LDL cholesterol. It
Hmm.
can go up to absolute zero. Even if it goes to absolute zero, one can still make a living,
Hmm. 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 Hmm.
but not a good healthy living. But yeah, so those are bad and good cholesterols. So rest, triglycerides, and total cholesterol, we do check if the first of all these two are in check. Then we usually focus on the other two. But these two are so essential for your heart health that the entire mechanism by which your heart attacks are occurring, which is your blockages, which I mentioned previously. So those are called atherosclerosis, and the atherosclerosis does have your oxidized LDL cholesterol, bad cholesterol.
Hmm.
So if I just happen to give you a story of atherosclerosis, quick, imagine this bad cholesterol is just running in your blood here and there, and blood your blood vessels are so good that they have a fence inside by which this bad cholesterol is not interacting with everything that's outside of the blood vessel,
Hmm. Hmm. Hmm.
right?
Hmm.
So that is, as you know already, it's called as endothelium.
Yeah.
Let's imagine that endothelium as a fence.
Hmm.
So I have a beautiful house, which is the blood vessels uh, body,
Hmm. Hmm.
and then I have a fence, which is your endothelium, and then I have a road, which is from where the entire traffic, which is your blood, is going on.
Yeah.
So let's imagine that this traffic gets a robber,
Hmm. Hmm. Hmm.
okay, a thief, someone who's a bad influence, and then if your fence is broken, if the endothelial defense mechanisms are down, it's he's gonna enter your house. So what happens is these LDL, so because of your, let's say, risk factors of smoking, your diabetes, hypertension, everything just causes damage to your fence. So that once your fence is gone, this LDL bad cholesterol is gonna come to your house. Okay, they just party there and they get what we call it oxidized.
Hmm.
So this is call in more friends, right?
Yeah.
So
Yeah.
they call in more friends, and then more and more LDL people are coming, more and more thieves, robbers are coming because now they have a house to live. They just they just make a good living, and now your body gets warned. Your neighbors are warned, so your neighbors call up the police. So that it's a the police is your body calls of, who's the police? So police are your defense cells. Those
Hmm.
are your macrophages, monocytes. These cells, which are your police, come over there. They see what's the party of oxidized LDL is going on, and what do they try to do? They just try to create another fence,
Yeah.
correct? So that traffic will still flow on the
Yeah.
road,
Yeah. Yeah.
but that should not be hampered because that's a major issue if that occurs. So what do? They build a more cap over it, which is made up of a lot of fibrous tissue, fibrofatty tissue, and which you call as they lay down the matrix.
Hmm.
This they themselves go and live with the thieves. So the entire party is now stabilized.
Hmm.
That's what you call a stable plaque, and this is how the process of atherosclerosis or just clogging the arteries happens. So that narrows the size of the road also for that smooth traffic to travel. And then once once what happens is once in a while the second fence, that fibrous cap that we spoke about, that gets damaged. So something or the other trigger is coming, more thieves are coming, more something is
That will also
uncontrolled,
break.
sugar is uncontrolled. that will also break. So entire this party needs who needs more space will come out of that fence, and then where it's gonna go? It's gonna go travel down the road, and when the road is so narrow that they cannot travel further, it's just gonna clog the vessel.
Okay.
So your blood supply is entirely stopped.
Hmm.
So that is when your that is what if that occurs in your heart, that is what we call as heart attack
Atherosclerosis,
and
heart attack.
myocardial infarction.
Okay, and what I know from my previous knowledge, like you have to get at least like 70 to 80% of blockade before getting the symptoms, right? You get a
Yes,
stable angina only after 70% of the coronary arteries blocked.
correct.
Yeah. So,
So that's what you can call coronary flow reserve. So your arteries are so good that the God is so great that it has given the defense mechanisms where even if there's a stenosis, your blood flow still goes on. Like 60, like you mentioned, we call it significant stenosis. Once it goes 70, 80, that is when we call it significant stenosis. That's when the patients start developing symptoms.
so symptoms are coming at 70%. Is there a way to predict that you will get a heart attack with using a biomarker which is available in your blood? You do using a blood test before that 70% occlusion?
Mm, biomarkers, yes, there are few biomarkers which have been tried. One of them is HSCRP, high sensitivity C-reactive protein. So if that is high in your system, it could just mean that your body is in a state of inflammation. So HSCRP is one. Then there's homocysteine. So if your homocysteine levels are high, homocysteine could also be a predictor that you have a state where your blood have a tendency to clog. They themselves are not thin, right? So that could also be a marker, future marker for your this high uric acid levels are indirectly correlated with your endothelial function. So if the uric acid levels are higher, that means your endothelial function is somewhat disturbed, and that's indirect marker for your metabolic syndrome and eventual heart diseases. So these are some of the markers I would say. And then again, there are a few investigations that we actually perform in OPDs.
Okay.
So one of the best would be to do CT coronary angiogram.
Wow, but
CT angiogram.
that is very like people won't get it done for just cases
I
of.
don't know. I study in a prime institute, which is like 10 minutes. I write it on a paper. They come and give me the report. So
Huh.
I don't know how it works in private practice, but yeah, I believe it's if at all one wants to clarify the doubt, there are investigations available as well.
So we have pharmacological agents known as statins. So do you feel
Right.
prophylactic statin use can be beneficial in preventing heart attacks?
Indeed, very much. It's proven also,
It's proven.
and especially if you've got risk factors, if you're obese, your lipids are haywire, if you've got diabetes, you are you're a male gender, you are more than 40, and you have a family history where there is a sudden cardiac death, sudden heart issues, then definitely statins are most go rather they're the only proven sources of prevention. And then by consuming statins, you are not just the plaque that we mentioned, the party that we mentioned. They're not just preventing the plaque, but that's modifying the plaque so much better that even the chances of it of deplaquing and causing further atherosclerotic damage is also less. The stabilization of the plaque is amazing with statins.
Okay, so are there any supplements or something like that which are like proven to be very beneficial for heart health? Because like I follow a lot of Andrew Huberman podcast and they talk about
Oh yeah, yeah,
MMN, resveratrol, which are found in red wine. So do you have any
yeah.
other supplements which are beneficial for heart health?
Yes, resveratrol is definitely a polyphenol, which is necessary for it is basically a product. It increases the production of a nitric oxide. So for nitric oxide, we need nitric oxide synthase, which is like I mentioned, is present in the fence, the endothelium of it, and resveratrol is just going to increase the amount of nitric oxide synthesis, so nitric oxide production is increased eventually, and that is how it's so good for your heart health. But like you said, resveratrol. But is wine consumption of wine as such safe? Although it has resveratrol, do you think just consuming a lot of
Uh,
wine is safe?
no. I like it should not like how people say like red wine is good for the heart. I think it's a very bad statement. If you want to get that beneficial compound, which is resveratrol, which is present in red wine, you can just buy that supplement. You don't have to use it as an
Indeed,
excuse to
indeed.
have another bottle of wine.
So I do use omega-3 fatty acids, and I believe those are amazing for your heart health. So there are two compounds. One is DHA and EPA, docosahexaenoic acid and eicosapentaenoic acid. And fish is a readily available source of your omega-3 fatty acids. Omega-3 fatty acids are something which increase the amount of your, as we mentioned previously, HDL, which is your what we want to call it, good
Good
cholesterol.
cholesterol. Hmm.
Yeah. And again, just by increasing your good cholesterol, you are eventually decreasing the probability of heart issues in future. So omega-3 fatty acids is something that I personally recommend as a prophylactic measure also. And again, there are dosages which are used to treat patients who have deranged triglyceride levels also.
So now we're gonna discuss about effects of a lot of daily consumed products on your heart. Okay, so we're gonna
Okay.
start with caffeine. So is it safe for the heart?
Oh, it's amazing. Provided you don't take it every hour. And
Then
how do you take it? With sugar, without sugar, how much milk?
yeah.
So it's the formulation also that matters.
Which is the
So
the best way of consuming caffeine for your heart?
mm, if you want to quantify it, then I'd say 100 milligram, 200 milligram, then one would not know how much that is. Uh, the if you are consuming it without sugar, that's the best. If you are consuming it once or twice daily, especially in the early hours of your day, I believe that's the best. If you want to add few compounds like your milk, it's fine, but sugar to be avoided. And I believe the more pure it is, like your black coffee, espresso, and all that, the better the results. It's got a lot of polyphenols, antioxidants, and does have some vasodilator properties, so it's gonna cause the your blood vessels to dilate so that it could accommodate more blood.
Okay, a lot of fashion influencers, fitness influencers, and models they tend to use diuretics before photo shoots to get that lean look. So, are diuretics safe for the heart?
Diuretics are safe if the dose and diuretics, and if you already have a heart condition and you don't want to make it even worse, that is when we are actually using diuretics, not to prevent a heart disease, but definitely not diuretics as
Because they
a
indiscriminate use of furosemide has been used by a lot of models and everything. They take it just one day before their shoots to lose that
that just
water weight.
loses the water weight and makes your skin look paper thin,
Yeah.
gives the better glow. I I don't think that should hamper heart health in acute condition if done like once or twice, like once for a competition. But I would not recommend that someone abuses it on daily basis. So just to get that look again and again for if you have photo shoot every week and you're just consuming diuretics, that just fools their end. So your electrolytes you are not measuring, your it's gonna lose some cause to lose you potassium. That's might just cause you heart
Problems
arrhythmias
with
and
yeah.
heart health. Yeah. So that you are not keeping in check.
वन ऑफ ये इंडिया के सबसे मेरे को सबसे चूतिया फिटनेस इन्फ्लुएंसर लगते हैं तरुण गिल सॉरी फॉर माई लैंग्वेज बट ही प्रपोज दैट पीपल शुड यूज वायग्रा एज अ प्री वर्कआउट एजेंट okay
Whoa.
so people who don't know Viagra, it is a
What workout are we talking about?
So Viagra is a phosphodiesterase inhibitor, and it like basically increases
Yeah,
nitric oxide and causes vasodilation. So
yeah.
मैंने ट्राई करके देखा था एंड लेट्स जस्ट से मेरी सारी मसल्स पम्प थी उस दिन. बट व्हाट आर योर
What
थॉट्स
sort of
अबाउट
workout? I'm still want to clarify क्या कौन से workout की बात कर रहे हैं?
जिम वाले वर्कआउट से पहले बोला था यार इस बंदे ने कि लाइक वाइग्रा खाओ और मैगी खाओ एंड पता है व्हाट लाइक बुलशिट रील्स ही हैज बीन मेकिंग. बट yeah, he has told his in like audience of at least like 10 million to consume Viagra before a workout, before a gym workout. So
Wow.
what is your stance on that?
Uh, like we spoke about, is unless you are suffering from some medical condition where you're not able to get it up, that's the only time when you should be using it. And I absolutely do not recommend it for any other purposes. Although there are hard conditions where we use it.
Pulmonary hypertension.
It's pulmonary hypertension, and those are either hereditary conditions, and there's when you want to cause your lung vessels to dilate. That's when we use it so that the pressure gets relieved. But for heart health and pre-workout supplement, like you're using sildenafil, the active compound in Viagra, for just dilating the heart, not just the heart vessels, but vessels everywhere, and increasing the blood supply to all the muscles which acutely need it for their recovery. No, please don't.
अच्छा.
I don't know Tarun Gill in that detail. I've just seen him once or twice, and I did not know that he recommends this. But if given me a choice, absolutely not.
What about
And I'm sure none of the medical faculty would have suggested.
but still like we are trying to connect the medical side with the non-medical fraternity here at Sushi Talks, and that is why these questions are
Indeed,
advice
indeed.
from my audience only. Can you tell me how to first of all, do you are you on the side of usage of anabolic steroids?
Oh, no,
Okay.
I condemn it. But if some unless and until your goals are like Mr. Olympia sort of competitions, and you are dedicated enough with keeping in check your testosterone levels, your other metabolic factors in check, that is when you might take it. But as an overall picture, just to gain muscle and you know as a source of being fit, oh, absolutely not.
Okay.
Anabolics are just no go.
So anabolic steroids के साथ like you are completely
Mm-hmm.
against. Like what
Against him.
what problems do they actually cause inside the body?
Oh, yes. So I've read articles about sudden deaths, sudden strokes. So one thing that the articles mentioned is vascular aneurysms. So that is when your brain vessels were dilated and they ruptured, spontaneously they ruptured. So testosterone is not just building your muscles; it's going to build overall other organs as well. So your heart, especially the heart size, is going to increase if you're consuming anabolics. Your size of your gut, the intestines, and other visceral organs might also be changed because of the same. And again, you are psychologically be deprived because you are externally consuming it. So your body is gonna get signaled as if you already have it, you don't need it. So your testes, your balls are gonna shrink, and
You're gonna
yeah,
get
the
problems like infertility and roid rage also.
infertility, erectile
Skin
dysfunction,
issues.
lack of libido, it's loss of libido. It's so rampant among these industry people. Although I'm
So
not an expert in treating them, these are just some of the things that I've read, come across, and have been asking my psychiatrist friends.
so in your practice, have you ever seen people who are like IV drug abusers with heart conditions?
Oh, indeed.
So what usually
And
happens?
IV drug abusers, okay, if they're sharing needles, the first thing is sharing needles. It's not just they're not just sharing the drug; they might be sharing infection as well. So that's infection gonna go to the heart, because that from there the blood supply to the organs. So the right side of the heart is just gonna the infection is gonna go and settle. So this condition we call infective endocarditis. So that could also be one of the things. And STDs, man, your STDs are gonna grow because of your sexually transmitted diseases. And among the STDs, if you want to ask me what affects the heart per se, there's syphilis,
Hmm.
but syphilis we commonly detect it at earlier levels. So for it to cause heart conditions, that's just old age thing. Nowadays, it's not happening.
Tree bark
But
appearance,
AIDS, man.
aorta key, and pathology. That's what I remember. Neuro and cardiosyphilis, like the late stages of the syphilis disorder.
Yeah, the late stages of syphilis, the tertiary syphilis kind of stages. So your AIDS, man, AIDS, your HIV is just affecting every organ, and at heart, it could cause your cardiomyopathy, just like your heart is gonna go in size. It could cause arrhythmias. It could it also causes dyslipidemia. So that is indirectly and causing metabolic syndrome. So that is directly causing your increase in heart attacks among patients who already have AIDS. So yeah, sharing needles indirectly is going to affect your heart as well.
Does cannabis cause any effects on the heart?
Oh yes.
Okay.
So there are no trials, but these are just observational studies. People have not people have not had controls and cases, so they cannot compare. But these are just some of the observations. So cannabis it's a it acts as cannabinoid system, right? So cannabinoid system CB1 and CB2 receptors. One of them is going to be in your brain. CB1 and CB2 is everywhere else. Your blood vessels, your heart, your intestines, everywhere. So what occurs is cannabis. Just imagine it like a stimulant. So acutely, what it can cause is arrhythmias. So it can cause benign arrhythmias like your atrial fibrillation for time person. But yeah, there are incidences where people have died suddenly because of malignant arrhythmias like your ventricular tachycardia and fibrillation. Also, those are also reported mostly in Europe. And again, it's if you're a regular consumer of all the substances, you might not just be consuming cannabis, but you if you're smoking it and you if you are adulterating it with nicotine, so that might that also has its own health hazards as well.
Okay.
So yeah,
So,
cannabis. I don't know. I don't know as some. I have not come across a patient who is chronic consumer of just cannabis and has a heart issue. But
okay.
yeah, there are reports as well.
Okay, so as a cardiologist, do you first of all do you practice cardio when you are doing your gym? Just be honest with me. Okay, do you skip cardio?
Uh, when I started my cardiology, that is when I started doing it.
मुझे लग ही रहा था मुझे लग ही रहा था
So I'm very lazy, man. I'm very lazy when it comes to just your cardio. So there's this book that I came across. It's the book is called as Outlive. It's by Peter Attia, and there was a whole chapter about the cardiorespiratory health. And when I read it, it was like a shock, and it was like, oh damn, am I just focusing on one aspect of health as a overall and ignoring my cardiorespiratory health, especially your VO2 max. And that's when I that's when I now started focusing more and more about cardiorespiratory health as well. It's okay if I lose the muscle, but I want to keep the biggest and the most important muscle, which is your heart, healthy, active, and going.
So, according to you, which is more beneficial? Like, I know, like high intensity and low intensity cardio states both are beneficial, but like, which is something that every person should do, like steady state cardio or like high intensity interval training?
Oh, so what WHO recommends for normal people is 150 minutes of weekly walking. So that's just 2.5 hours of weekly walking, which is your moderate intensity, and which is your normal intensity, but that along with two times resistance training, which is your moderate intensity, each of about 30 minutes would suffice just to keep your metabolic health at a baseline, I would say. But if you want to take it to the next level, yes, the high intensity interval training is amazing. The steady state cardio is amazing. Moderate intensity training has its own perks. I do not I do not have inclinations toward any of them per se, but whatever suits you. And they say zone two training where you aren't you are you are running, you're walking, you're making your heart run, your heart rate is going up, but still you are able to maintain your conversation. That at that pace, if you are able to do 30 minutes twice a week, I think that's really good enough for at least everyone.
Okay, okay. And let's just say one person wants to get their heart checked. Okay, so should they get an ECG done or an echocardiography, and like in what intervals?
Okay, so that will also depend on your age, and that will also depend if you are symptomatic for anything, and if a healthy adult, if it's just a healthy adult wants to get his heart checked, what I would recommend is yes, ECG is basic. That's like a that's like a window to your heart, and few blood workup I would suggest that everyone must do. That could just be your fasting blood sugars, your postprandial blood sugars, like you mentioned before, lipids, then your complete blood count and renal function test. These should be just basics. If any symptoms, even if it's a atypical chest pain or something, just to clear your doubts, you can go for echocardiography. So yeah, blood checkup, ECG, echo. These are like base level investigations. Then there are fancy ones for, of course, those who are symptomatic.
And just about to end the podcast now, but with a Bollywood का reference. So there are
For sure.
two doubts that I had. Like एक movie में बोला था कि मेरे दिल में छेद है, इसकी दिल की छेद की सर्जरी हुई है. So what is this दिल का छेद exactly? What are they talking about?
Oh, Dil Ka Chhed is many things, man. It's as you know already. It's happened in the adulthood. It's got to be something like atrial septal defect. So the upper chambers of your heart, they have a hole in it, so they're talking to each other. And if it's happened in the childhood, it's got to be something like ventricular septal defect, VSD, TOF, or some sort of surgery that is happened during early childhood. So वो surgery कब हुआ है वो भी important है.
नहीं नहीं, मैंने वैसे मूवीज में देखा था ना कि हाय हमारे पास पैसे नहीं है, दिल का छेद का सर्जरी कराने का, तो अब वो वाला.
Yeah.
हाँ, एक ये था और एक वो भी था. एक मैंने कोई साउथ इंडियन फिल्म देखी थी जिसमें ना वो लाइक बंदा लाइक ही इज अनकॉन्शियस एंड एक बंदा लेके नीडल लेके यहाँ पर सीधा हार्ट पे डालता है, नाउ ही इज रिवाइव्ड. लाइक so what is that procedure? Do we even do this needle thoracotomy or
Was it
what, some South Indian
was it in heart or was it in lungs?
हार्ट में
Needle कहाँ पे डाला?
सेंटर में, बिल्कुल सेंटर में हार्ट पे डाला, क्योंकि हार्ट अटैक आ गया उसको.
यार he just did basic version of cardiac pericardial sentences, I would say. तो तुझे पता है कि टैम्पोनॉड क्या होता है? जैसे हार्ट के बाजू में पूरा ब्लड या फिर पानी भर गया है, तो हार्ट पंप ही नहीं कर पा रहा है, कॉन्ट्रैक्ट नहीं हो पा रहा है, डायलेट नहीं हो पा रहा है, कुछ भी नहीं हो पा रहा है, हार्ट इज लाइक स्टैटिक. तो वो पानी पानी जो हम निकाल रहे हैं, दिस पेरिकार्डियल फ्लूइड दैट वी टेकिंग ऑफ, पता नहीं उसने निकाला भी कि नहीं, सिर्फ नीडल डाल के रख दिया.
Okay, so
But yeah, pericardial sentences we do, and oh god, it's just an amazing to see patients come back to life.
and let's just say some person like collapses in front of, let's say, a non-medico. So what should be the first line of like thing management? What he or she should do?
Oh yeah, so basic life support says first and the foremost, you have to make sure that the scene is safe. He is safe, right? He should not be on a train track and then you're doing the efforts. You have to ensure scene safety first. So once you've done that, the next thing you have to call for the help. So just right away call for help You have to activate the emergency response system and call for the ambulance. Just tell next person next to you to call for an ambulance, and you yourself do it. Then you have to go and check two things, right? You're going to check the pulse of the patient, and you're going to see if he's actually breathing. So
पल्स कहाँ पे चेक करना
if
है?
best is to do carotid here, right? So just put your fingers here. If any bounding sensation that you're feeling, that's got to be the pulse. And then you have to see if he's actually breathing. Is there a chest rise? Are you seeing any efforts here? So you've seen any of the efforts. So those two things you have to check. If there's if there's uh, let's imagine three scenarios where first is when he's breathing but there's no pulse. What you'll do is just start chest compressions. So that will cause heart to keep circulating the blood to your important organs. Next scenario is when there is pulse, but he's not breathing. That time you'll just provide rescue breaths, right? So it can be a mouth to mouth, or if there's a bag mask, you can do that. And the third scenario is when there's
No pulse,
nothing,
no breathing.
no pulse, no breathing. That is when you have to use your CPR, the 30 compressions, and along with it, you have to give two breaths after the interval of 30 compressions. So in a minute, you have to give 100 to 120 chest compressions, and 3 or 4 times you have to give rescue breaths.
Okay, let's imagine an unfortunate scenario, and this time it's a child. So how is the CPR?
Oh yeah,
Yeah, how is the CPR different in case of a child?
yeah. If the child is really young,
Yeah.
like an infant or 2 years, 3 years, so then the technique of the CPR is not this, right? So technique is going to differ. If it's really young, you can just use your fingers to do the CPR, or you can just close your fingers or hold the thorax and then push the middle bone to
Son.
give the CPR. So the technique is going to different, gonna be different. But child scenarios are extremely scarce,
Yeah.
and everyone should know basic CPR techniques is what I feel. And yeah, these 3 4 things everyone knows. Less than 1% people in India know basic CPR. Even I think doctors are also confused with what to do.
Yeah. After this re-NEET controversy, I think a lot of confused doctors will be there in India. वैसे भी. I think we are the last of the good doctors now. ठीक है?
Oh, what man?
2024 batch के बाद से I don't know. We don't trust them. So this was a beautiful conversation, sir. Thank you so much for explaining like the
I was
A
my
to
honor, man.
A to Z
I'm
about
so happy
heart
to.
health. And
Yeah,
hopefully we can sit offline में कभी and have this discussion one to one, and we can
oh yes, yes. You can
talk
sponsor my
about.
Delhi trip.
हाँ बिल्कुल डिटेल में घुसेंगे नेक्स्ट टाइम. होपफुली तब तक मैं भी MS कर चुका हूँ, समथिंग लाइक MS MD, पता नहीं. आई डोंट नो वेयर लाइफ इज टेकिंग मी, बट थैंक यू सो
Don't send me
मच.
your ECGs just to get free surgery fitness.
डन है.
I'm not doing that.
रेफर टू मेडिसिन. ठीक है. थैंक यू सो मच
Sure.
सर. And
Thank you so much.
hopefully guys you enjoyed this podcast. Please click like, subscribe, and we'll put sir's FitDoctor in the description, and please follow him on
Thank you so
Instagram.
much.
And Sushi Talks will be airing soon. Thank you so